Bonjour tout le monde. Hi everyone. Mon nom est Catherine Lévesque du National Post. Je serai votre modératrice aujourd'hui. So with us we have the Honorable Patty Hajdu, Minister of Indigenous Services, Dr. Tom Wong, Chief Medical Officer of Public Health, and Patrick Boucher, Senior Assistant Deputy Minister of the First Nations and Inuit Health Branch, and they will provide an update on COVID-19 in Indigenous communities. So we'll start with remarks, and then we'll take questions on Zoom. Please, a reminder to raise your hand on Zoom if you do have a question. And I'll hand the floor to you, Minister.
Well, thank you very much, Kwekwe, Uluku, Tanzi, hello, bonjour, bonjour. I'm speaking to you again today from the Robinson Superior Treaty Territory area, and I'm on Fort William First Nation today. Miigwech for welcoming me, and also there are many Métis people who have contributed to this beautiful area. Thank you for being here for our semi-regular updates. I am joined by my usual guest, Dr. Tom Wong, who's the Chief Medical Officer of Public Health, and Senior Assistant Deputy Minister Patrick Boucher of the First Nations and Inuit Health Branch. As always, we'll provide a brief update on the overall COVID-19 situation for Indigenous communities, as well as some of the supports in place, and we will then be available for questions. First of all, on behalf of everyone, I would like again to thank everyone who's doing their part to stop and slow the spread of COVID-19. This is obviously work that we do together. It's communities that are continuing strong public health measures. It's people standing up, getting vaccinated, helping others to get vaccinated. It's people staying home when they're sick, or frontline healthcare workers who continue to keep our systems going. These are the incredible people, the incredible Canadians that are working so hard every single day to keep people healthy. Si je peux me permettre d'adresser rapidement les sujets de ce matin, une décision a été rendue par la Cour d'appel de Québec concernant le projet de loi C-92. Comme cette décision vient d'être rendue, notre gouvernement l'examinera attentivement et y répondra bientôt. Mais j'exprime encore notre engagement qui demeure absolu. Soutenir et reconnaître les compétences des Premières Nations, des Inuits et des Métis en matière de services à l'enfance et à la famille s'ils souhaitent l'exercer. Nous avons développé et adopté le projet de loi C-92 en collaboration avec des partenaires autochtones dans le but précis d'affirmer le droit des Premières Nations, des Inuits et des Métis à l'autodétermination et en matière de services à l'enfance et à la famille, de garder les enfants et les familles ensemble et de fournir les outils nécessaires pour mettre en place le soutien dont ils ont besoin. Je sais que beaucoup de gens suivent de près cette décision, mais comme elle n'a été rendue publique ce matin, nous allons l'examiner et nous aurons bientôt d'autres informations à partager. So Dr. Wong will provide a bit more detail in a moment about the situation with COVID-19 in Indigenous communities, but looking at the reported daily active case counts in Indigenous communities this week, we're seeing a 13.2% decrease from last week. And this is bringing some optimism that the worst of Omicron and the Omicron wave is behind us, but there are still areas of the country where we see cases rising, and we do see in some communities that the risk of spreading remains a very large challenge. So I know this is not the news that people want to hear, but we need to continue to be vigilant. We need to continue to work together to protect each other, to adhere to the public health measures that we know can help stop the spread of COVID-19, to protect lives. Si l'on examine le nombre de cas actifs déclarés quotidiennement dans la communauté autochtone cette semaine, nous constatons une diminution de 13,2% par rapport à la semaine dernière. Before I turn it over to Dr. Wong, I did want to highlight a few additional areas where we're providing supports and where supports are being mobilized in communities. This morning, Minister Blair announced that an RFA had been approved for Mishkegowgaming First Nation in Ontario, which currently is dealing with an outbreak and increases in cases. Similarly, a request for assistance has also been approved today for Ibumatang First Nation. And these requests for assistance will allow Canadian Rangers to help with the various needs of the communities as a number of residents are in isolation or recovering from COVID-19. The Canadian Armed Forces continue to be engaged through a number of other RFAs to support a number of other communities. And as community members and healthcare workers need space to remain in isolation, Indigenous Services Canada has also been able to support communities like Kinojeoshtegon in Manitoba to install temporary mobile accommodations for 4 healthcare professionals who are on site to help with pandemic response, as well as in Pheasant-Rump Nakota in Saskatchewan, where 2 mobile units are now in place to assist with isolation needs. I also want to highlight a very interesting campaign called VaxChamp, put together by the First Nations Health Authority in BC. And this campaign is encouraging young people to share photos of themselves getting their vaccine and sharing the reasons for getting vaccinated. And you can see some of their wonderful stories on the First Nation Health Authority's website. And so we do see positive signs of this wave subsiding, but we do know we have work ahead. And we do know that when we work together, that's how we protect each other, we protect families, we protect our loved ones. As always, please get your vaccine and your booster shots when it's your turn. They continue to be a strong tool, and I emphasize that they're just one of the tools, but they are an important one to keep ourselves healthy, to protect lives, and to protect everyone around us. Miigwech, Kuya-Inanwek, Merci, thank you, merci.
Thank you, Minister. I want to acknowledge that I'm on the unceded territory of the Algonquin people. Je tiens à reconnaître que je me trouve sur le territoire non cédé du peuple algonquin. Les cas actifs reportés commencent à descendre. Avec des efforts collectifs continus, nous allons pouvoir passer à travers cette vague d'Omicron. Reported active case counts are starting to trend down. With continued collective efforts, we will get through the Omicron wave together. Our individual actions have a large impact collectively, using a layered approach, including getting vaccinated, whether that be a first dose, second dose, or booster dose when eligible, masking, physical distancing, and other personal protective measures. While vaccinated individuals can still be infected with Omicron, the vaccines are very effective in reducing the risk of hospitalization, ICU admission, and death. The decisive actions of First Nations, Inuit, and Métis leaders and communities, together with the sacrifices of health and essential workers, are saving lives every day. Self-determination, local context, and community evidence are key to guide when and how to cautiously and gradually relax public health measures by Indigenous communities. I want to encourage everyone to take care of their mental health and to check in on those around you. Reach out to elders, family, friends, and community members, and lean on one another for strength during these difficult times. Miigwech nakumek, merci, merci, and thank you. Over to the moderator.
Okay, thank you very much. Merci beaucoup. Donc, nous allons débuter la période de questions. We'll start with the question period. As a reminder, please raise your hand on Zoom if you do have a question. We're going to start with members of the gallery and then non-members. And just as a reminder, the way it's going to work is that I will allow you to talk. You can unmute yourself and ask your question and follow up. So we will start with Olivia Stefanovic, CBC News.
Yes, thank you so much for taking our questions this afternoon. My questions are for Minister Hajdu. Minister Hajdu, I'm wondering if you can comment on the Quebec court's decision today on C92 child welfare. I just spoke to a legal expert who calls this decision devastating, and I'm wondering if you would agree with that assessment and if the federal government will appeal.
Thank you, Olivia. And first of all, let me be clear. We will do whatever it takes to ensure that First Nations people have autonomy over child and welfare and the ability to reconstitute communities and families. But having said that, we are still digesting the court decision, and we'll have more to say about the approaches that we will take with that decision in the near future.
Thank you. And as a follow-up, does this decision today basically neutralize any efforts from Indigenous communities to overhaul their child welfare system?
Again, I'm reluctant to weigh into the details of the decision as I'm still working through the analysis with my team. But I will say this: the federal government's commitment to upholding C92 and the principles behind C92 remain firm. This is a critical ingredient in reconciliation. Is Indigenous people having autonomy over their ability to care for their children, to reconstitute families, to support healthy child development, and we will be there for Indigenous communities in their endeavors.
Okay, we're going to go with Zach Becerra from the Saskatoon Star Phoenix. You can unmute yourself.
Thank you so much for taking my question. Minister Hajdu, here in Saskatchewan, government's announced plans to drop all remaining COVID-19 public health measures. Other provinces are announcing similar plans. And we've heard concern from many First Nations leaders that this is premature and they worry about the impact in their community. I wonder what Indigenous Services Canada's official recommendations are to First Nations in these provinces, as well as how First Nations might be able to effectively enforce their own measures in the absence of a provincial health order.
Well, thank you very much for the question. And we are, as Dr. Tam noted, and I believe Dr. Wong believes, at a very tricky point in the pandemic, in that we've had measures that have been successful, we've had measures that have been less successful, and governments and indeed communities are grappling with how best to protect citizens and what measures need to be in place to continue to protect people from infection and indeed death from COVID-19, but also how best to ensure that our communities remain functioning. And these are important questions and important conversations. I will say this: Indigenous Services Canada has been there through the lens of self-determination for communities from the beginning of the pandemic, through the things like the access to financial supports for COVID response. In various different communities have imposed various different public measures, and Indigenous Services Canada has supported those communities in those measures, and will continue to do that. This is a difficult time. Indigenous leaders obviously are concerned. Many of their members have underlying health conditions that are overrepresented, and they're doing their level best to protect citizens. And we'll continue to work with Indigenous communities as they put into place measures that are appropriate and that are evolving as our understanding of the virus evolves. So I'll turn to Dr. Wong if you want to say a few more words.
Yeah, thank you very much, Minister. As the Minister said, self-determination and the local epidemiology, the local evidence in the community and the local context is so important. It's incumbent, upon us, to be supporting Indigenous leaders, Indigenous communities in order to have the best protection that they want for their community. Whether there's a requirement or no requirement, it's like going outside when it's minus 30. Outside. There's no requirement to actually wear a winter jacket. However, one may want to consider doing that in order to maximize the warmth, and in this case, maximize the protection for the elders, for the vulnerables in the community. Thank you.
Thank you. And if I could ask a second question or a follow-up question to Minister Hajdu on a different topic. There's a significant tuberculosis outbreak in northern Saskatchewan right now. 40 identified cases, a quarter of them in children, 2 deaths linked to the outbreak. My understanding is that some community leaders may have approached Ottawa with a request for more suitable housing in the north, housing being understood as a vector of tuberculosis spread. I'm wondering if you've received that request and if you can speak to what the federal government is doing in response to this outbreak.
Thank you very much, Zach. And I think you've hit the nail on the head. And Indigenous leaders have spoken about the need for better housing and suitable housing for a very long time. I'm extremely preoccupied with this. Every meeting I have with Indigenous people across this country on First Nations and in remote communities have spoken to me about the need for better housing, more sustainable housing, healthier housing. I am unaware of this specific proposal, but I certainly will go back to the department to uncover it. I know that Dr. Wong has been working with health authorities in the province to do work on this tuberculosis outbreak, but that connection between housing is clear, and it's critical that we do more.
Okay, seeing that
Dr. Wong, Dr. Wong, I did want Dr. Wong to just speak a little bit about that last question, if that's possible.
Well, thank you very much. In addition to what the minister had just said about the importance of housing and other social determinants of health, absolutely. In addition to that, the need, to have equitable, culturally appropriate and timely diagnosis, screening, treatment, contact tracing, and search capacity. We at the department, is fully behind the community, the Northern Intertribal Health Authority and other First Nations leaders in order to support the communities in order to beat the tuberculosis. It is so important that we support the community in order to do the best to prevent, treat, and eliminate TB. Thanks.
Okay, sorry about that. Seeing that we still have quite a lot of time, maybe we can do a second round of questions. I don't know if the reporters on the line still have some questions. You can raise your hand. Okay, we're going to go with Zach. You can go ahead.
Yeah, I'm back already. I'm wondering if you can provide more details, if you don't mind, about how ISC is responding to that outbreak in Northern Saskatchewan, Dr. Wong.
Thank you very much, for the follow-up question. We have been supporting the First Nations partners in Northern Saskatchewan in order for them to be able to mobilize prevention, diagnostic and treatment modalities in order to best support the communities. And, with one of the things with TB is very similar to COVID. It's spread, by the respiratory route. And so many of the measures against COVID, are beneficial, for TB. With that, there are needs, for whether it's preventive treatment, with rifapentine, with a medication, that offers a very short course, of treatment instead of the usual up to 9 months of treatment for latent TB infection or the sleeping TB infection. We have made available, the rifapentine, one of the combos that can be used to shorten the treatment duration for latent TB infection to prevent the progression to active TB. And this is an oral medication in combination with another medication called isoniazid in order to actually prevent, the progression. And that's to be taken once a week. And so it's much easier to take, it's much easier to complete, and it's a shorter duration. And we are supporting, the communities and the health authorities, with equipment in diagnosis, including, the use of rapid point of care tests as well for TB. So thank you.
Thanks so much, Dr. Wong. And if I can ask our question to Mr. Hajdu as well, back to COVID-19. I know we're bouncing between respiratory infections right now. I want to ask you a little bit more about how First Nations in Saskatchewan should proceed as measures drop. There was a pretty clear statement from the Federation of Sovereign Indigenous Nations and also member tribal councils expressing a lot of concern about this move from government. I know one of their major concerns is that there won't be able to enforce any kind of local public health measures in the absence of a provincial measure. We saw that challenge here in Saskatchewan over the summer, notably in Hajdu Lake Dene Nation. I wonder what dialogue the federal government is having with the provincial government right now on how to avoid a similar situation if First Nations choose to keep measures in place.
Well, I will turn to Dr. Wong actually, because he's along with Dr. Tam, the one that would be meeting at the Special Advisory Committee with medical officers of health across the country, and would have more concrete information about how those conversations are proceeding.
Yes, thank you very much, for the question. We work with the Public Health Agency of Canada and all of the public health officers from across the country in order to make sure that, the message is clear, that the measures required, in order to prevent the spread, in order to prevent hospitalization, ICU admissions, and death. We have all the tools there. And different parts of the country may be experiencing, the pandemic differently. Some, maybe on the upswing of the curve. Others may be, on the plateau part of the curve, and others, on the downside of the curve. So each community, each region of the country may have different needs. However, the key, approach is the need to support communities, the need to support Canadians, with the tools that they can use in order to best protect themselves, protect their loved ones, protect their communities, according to the local context. Thank you.
And maybe I can add, Zach, that it also is a really, really important reminder that vaccination efforts have to continue, that the best protection against severe illness and hospitalization and death from COVID-19 is to be fully vaccinated. So we'll continue to work with Indigenous partners and support that vaccination effort across the province to make sure as many people are as fully protected as possible as we see measures adjusted, especially.
Okay, Olivia, you can go ahead. You can unmute yourself.
Thanks for coming back to me. I'm wondering if we can get an update on efforts to help train local people and communities to become water treatment plant operators. And are you looking for more funding in the upcoming federal budget for this?
Well, thank you, Olivia. And there is quite a bit of work happening. Unfortunately, I don't have details for you right now, but we'll make sure you get those for your efforts. But there is quite a bit of work happening across jurisdictions to support the training of water treatment operators, but also I think pivotally focus on ensuring equity and pay structures, for example, for water operators, so that water operators can stay in communities, can prosper in communities, and continue to serve communities. I also noted, though, that the weakness in our approach to ending boil water advisories, according to the Auditor General, was on the operation and maintenance side. And I have discussed that with my colleagues, and we'll be looking at next steps about how we close that gap as well.
Thank you. And on a different topic, Minister Hajdu, there's been several stories that have noted that with the ongoing convoy protests, that if the people protesting were perhaps the majority of them being Indigenous or people of color, that perhaps the response would be different. And I'm wondering if you agree with that, what you think of what is unfolding right now.
Well, let me be perfectly clear. People are suffering as a result of, folks that are occupying spaces in Ottawa, but also blockades that are happening at various ports of entry. I know my colleagues are working on this issue very diligently with provincial and municipal partners. And without a doubt, this is putting lives and economy at jeopardy. And I fully support the efforts of my colleagues to end this situation as soon as possible.
Okay, thank you very much, Minister and Dr. Wong and Mr. Boucher. This ends this press conference. Ceci met fin à la conférence de presse. Bonne journée.